So thank you very much, and thank you for inviting me to speak to you this morning. I am really excited about what's been going on in Lancashire, South Cumbria, and I'll share a little bit of why shortly, but I would also just want to echo what Amanda set out. If we don't tackle and get population health management as being the sort of way we do business for public services in general, we are never going to solve the issue, the crisis that are just going to keep getting worse. And I guess the other statistic that I would draw out, and this will be one familiar, but I think it's worth remembering, 90% of what we spend our money on in the NHS is about access to clinical care. And we know that only 10% of anybody's health outcomes relates to access to clinical care. So we've got a massive imbalance in how we are investing our money to try and support people's improvements in their health and well-being. Yes, we have to tackle the crises and sustain services and make sure nothing's falling over. But at the same time, a lot of what we can do to do that is not separate. We know that people with health inequalities, people with really poor health, are some of those that are constantly accessing A&E that we can do better for. We can improve what we're trying to put in terms of care and support to prevent that happening. So I think that, echoing Manda's point again about we do have to tackle the now, but working on this now is going to get some quick wins, not just for the next sort of 3 to 5 years. And I think that's where we've been really excited about this programme, which was an experiment, and you were one of the 4 that were chosen to help us with this, to understand and to learn what we could actually get from this. But I think what we're seeing in all of the sites, and in particular in Lancashire, South Cumbria, is some really impressive progress that, if sustained, I really believe we'll start to see some improvements in people's health and well-being and in some of the short-term demand issues quite quickly. So just a quick reminder as to what on earth we are trying to do here. And I know some of you know this inside out, but we are all trying to focus on, as integrated care systems generally, but in particular with this programme, what it is we can do together by working across services and across organisations to really focus on our local communities that we are all trying to support. How do we do that really focuses on what matters to them for their health and well-being? And essentially, population health management is the way to do that. It's a function, a business function, that we're trying to embed as the sort of foundation, I guess, for integrated care systems that really ensures data drives decision making. So we get the best possible outcomes for the people that we're trying to support for the best possible value. As you'll all have seen, this population health management has got a lot of traction in the last 12 months. I think it's fair to say that sort of April time last year, it was a bit of a new concept. People weren't really sure what it was about, what it meant, why it was different from what people had already been doing in public health. But since then, I think what we've seen is this being a way that people recognise that we can really do something different. So it's gone into the long-term plan. It's mentioned in a number of ways throughout it. It's also gone into the GP contract, and in particular the DES for primary care networks, which is really exciting, and I think gives us therefore the groundwork to leverage this to be able to be implemented to its maximum effectiveness. And I think what you've been able to do in Lancashire and South Cumbria in the last 12 months is really accelerate where you are. So you're well ahead of the game in terms of this becoming a reality for you and your population. Just a quick reminder as to what this was. We wanted to experiment with what data we could get to really understand the difference it could make for people on the ground. And we chose 4 systems, very different in terms of population, in terms of geography, in terms of size and complexity. Yourselves, Leeds as a place within West Yorkshire and Harrogate, Berkshire West, which is smaller in the south, and Dorset, to try and understand what both were the similarities of how to do this, but also what were the differences, so that we could learn how to spread this as quickly as possible, but also accelerate progress within the 4 systems by sharing the learning across. We had 3, I guess, key criteria that you, as one of the 4, we were assessed against. One was the leadership and the commitment to the programme. And I think what's been really fantastic about Lancashire and South Cumbria has been the leadership from the exec team, but also the leadership from each of the each of the places within Lancashire and South Cumbria and the leadership from each of the primary care networks. That has really galvanised progress here and is definitely something that's different from some of the other systems. And the commitment to want to do this and to put the time and effort in, as Amanda said, with everything else going on, it's been really encouraging to see that this has stayed as an important thing for you guys to want to do and to progress. We also looked for availability of linked data, and some of the work that you've been doing around the digital strategy and the work that Declan and team have been leading really, again, put you in a good position with that. As we know, there's always more we need to do around linked data, and I know that's been one of our key learning points over the last 12 months in terms of how to have some local solutions whilst we're waiting for the national solutions to catch up. And the readiness of neighbourhood and primary care networks, again, what was great for Lancashire and South Cumbria is that you had some really strong primary care networks that saw that this could really benefit them and their local population. And again, that was a real strength for Lancashire and South Cumbria, and I think has been why some of the progress that we've seen has really accelerated. So in terms of just the coverage, a nice map for you too, for those whose geography is not great, where Berkshire West is in comparison to Dorset. I certainly had to learn that. We've had over 200 participants over the last 6 to 7 months on this programme. We've had lots of different workshops across the 4 sites, a lot of time and intensive support on coaching, on action learning sets, a lot of different support for exec level networking and sharing progress and looking at what some of the senior level decision making needs to look like for the future. A lot of primary care networks and bringing together people that have never really worked together on some of this before. A lot of work with analysts and how to bring analytical people together to share their expertise and skills, and various online webinars and resources that have been developed as well. I won't go into the detail on this. That's there for people to look at afterwards in just terms of some of the examples from other systems. But I think some of the main successes that I wanted to pull out today, which again I think has been really evident in Lancashire and South Cumbria, has been a rapid progress around the PHM cycle. So for you, I'm sure it's embedded in everybody's minds, the PHM cycle. I'm sure you go to sleep with it on your eyelids. But essentially how we go through the cycle, looking at the data, the interventions, and actually making change. This isn't about having loads of really lovely data and nice graphs and pretty pictures. This is about what we do with it. And I think what's happened in Lancashire and South Cumbria has been really powerful in terms of the changes you're actually starting to make with that. There's been a real strong development of primary care networks as a result of being on the programme. That's what we've heard from the 4 systems and again from you in Lancashire and South Cumbria, that the ability to just have some time together, to have some space to think about what you want to do and what you need to do that will make a difference for your population, the support to be able to start to change things has really strengthened the relationships within primary care networks, but also within the places in terms of where this is starting to spread and have a knock-on impact for other primary care networks. The analytical groups has been a really interesting development. So for the first time, instead of lots of analysts sitting within their own organisations, interpreting data in their own ways, we've started to see analysts come together either in real or virtual teams across places and systems to start to really look at what is the one version of the truth that everyone keeps talking about. What does that really look like for the 4 different systems? And how do you drill that down into meaningful data for both the place and the neighbourhood, the primary care networks? And I think that's been a real sort of a development that will continue to progress, where we start to see people actually develop almost an office of analytics or an analytics function across a system to start to become a thing and start to become a business arrangement for the system to be able to look at all of the data that makes sense. We've started to see, as I said, improvements to patient care with people actually recognising some of the patients that they didn't know were at risk with this data. So we've started to see people being identified, for instance, on frailty registers as having mild to moderate, but starting to show symptoms of becoming more at risk. And they've been proactively targeted to bring in, to have an assessment and to look at what sort of care and support to put in place. So that's been a real benefit, starting to really impact on local populations. And the other amazing thing about this is the energy to continue. So this has been a 20-week programme. I'm sure, as you'll all sit here and reflect on, it'll be quite an intense 20-week programme with a lot of expectation and a lot of commitment from people who've participated. But what's been amazing is the energy's continuing into, so what can we do next? How do we keep this going? What do we do with our other neighbourhoods and our other primary care networks? How do we join up in some of the neighbourhoods into how that would look at a place level? And so the emerging roadmaps that everyone's developing in the 4 systems, and particularly yours in Lancashire and South Cumbria, are really strong in terms of the evidence of the commitment to make the progress be sustainable, but also to accelerate and spread widely. So some of the key learning, I guess, for us nationally, which we're taking into how we think about what next with this. I think the think big, start small, and for those of you who know about quality improvement, either through this or before, the use of improvement cycles to just get going with this, to start seeing something happen, has been really important for people on the programme. Definitely buy-in from leadership, and I think that was a really important message from this that we've taken away, that if there isn't the commitment from the leadership at all those different levels, then this won't have the benefits that it needs to. That neighbourhoods and primary care networks are absolutely essential to making this work. It has to be as close to the person as possible that we're trying to make a difference for, to actually be meaningful in terms of the changes that need to be made. Clinical involvement alongside analytics is really important. And what's been interesting is seeing some of those leadership teams at primary care network and neighbourhoods emerge, where a clinical lead along with an analytical lead along with a public health lead have really focused on bringing those areas of expertise together to think about how to make the biggest difference. The action learning sets, as I mentioned earlier, have been a really powerful tool for galvanising change, but also building relationships, building trust on the ground. And I think that's something we hadn't envisaged being quite so strong in terms of the learning for us. So it's definitely what we're looking at taking forward into the next cohort. IG, I don't think I need to say anything more about this. I think we knew it was going to be difficult. But again, what's been interesting is how local areas have come up with solutions that are perfectly legal, but actually do make a difference to being able to link data in real time to get the most effectiveness from it. And I guess what was also really interesting was that what's happened in a lot of systems, and I think this is the same for you, is that it's helped stimulate some of the progress that was already being made in pockets, some of the great work that was already being put in place in different patches, and accelerate that and spread it more widely, but also give it the kudos and the recognition as to being good practice that others might want to adopt. So we are currently collating all of the learning, and Ipsos Mori are helping us with this, and no doubt they will want to talk to various people from the different systems to understand from you what you've thought about it and what's been of benefit to you. We're looking at that evaluation to really understand what we need to do for a next cohort. We think, but it would be really great to get your views on this. We think this is beneficial as a way of getting this going, of kickstarting what PHM could mean for local systems, but also more importantly, how to start to make change quickly in terms of patient care, population health and support. So we're trying to think about what would a second cohort need to do that would be the same as what you've benefited from or different. We're also setting up, as a result of a lot of the learning from this across the 4 systems, a PHM Academy. So that will be a way of trying to continue to spread the learning, to spread the resources, to spread the case studies, so that people aren't all starting from scratch. We're looking at putting online tutorials and e-learning modules as a way of continuing to, for us to understand what works, but to also rapidly spread that. And we'll be continuing to ask people like you to share with us what you've done that can help others. And other than that, I would just want to say a huge thank you. As I said at the beginning, this was an experiment. We didn't know what we'd get from this. We didn't know how much benefit or progress we'd see. We didn't know how much time and energy and commitment would be needed. And I think, as I said before, it has been intense. It has been 20 weeks of solid thinking, work and commitment from people on the programme. But I think it has also been a stimulus because of that to really accelerate the pace. We do have, I guess, expectations, as always. So as a result of the investment that we've put into this and with you, we do want to see that this does continue. We want to see that this becomes embedded, and we want to help you continue with that. So we want to see this spreading across the places in Lancashire South Cumbria, and we want to see this as a way that Lancashire South Cumbria ICS starts to do business. But thank you. It's been a hugely positive experience. I think Lancashire and South Cumbria have really grasped the opportunity and are probably one of the furthest ahead in terms of the four, but you're also one of the furthest ahead in the country on this. So people will be looking to you to understand how to do this. People will be looking to what you're doing to understand what they could learn from it and implement for their population. So thank you for your time, for your energy, and for your ideas, and please keep them coming. And that's where we'll be putting all of the resources, all of the learning, including what else comes from you for the future. So if you want access to that, we can make that happen for you. But other than that, I will just say again, thank you very much. It's been a great 20 week, and look forward to the what next for you. So thank you.